Kyle. Chances are you've heard about LASIK, but is it the right procedure for you? Dr. Jeffrey Whitman of the Key-Whitman Eye Center is here to tell us what makes someone a good candidate for the LASIK procedure. Good morning. So good to have you here.
Great to be here.
Okay, today I'm going to shake things up a little bit, do something different with patient descriptions. Then I'd like you to tell me whether this person I'm going to describe will be a good candidate for LASIK, okay?
I can do it.
Throw you for a curve here, okay. If someone is tired of wearing contacts because it makes their eyes irritated and dry, would that person be a good candidate?
Well, first we're going to do we have sophisticated computerized tests to make sure, their correction's right, the shape of their eyes right, and then we're going to find out what type of dry eye they have, treat it, and then they should have the ability to have the best uncorrected vision again, hopefully be without their glasses, and they get to see well, and their eyes are going to feel better, no contact on there anymore. It really works for the dry eye patient as well.
Okay, let's say the person is 27 and can't see far away without contacts or glasses.
Well, that's kind of the sweet spot for LASIK. The majority of patients in their 20s, 30s, and 40s, and they're usually moderately nearsighted. In other words, they're having problems with their far away vision. And LASIK, really, that's just perfect for them. They can, the far majority of those patients are going to see 20/20 or better and be free of their glasses.
Okay, so let's change it up a little bit. Let's say the patient is 35 and super nearsighted in this case, and barely able to see the big E on the eye chart.
Meaning glasses like this.
Yes, Coke bottle glasses,
Coke
I think
bottle
is what
glasses.
we used to call them. Oh my gosh.
And so there are patients that are not good candidates for LASIK. But the great thing is at Key-Whitman is that I offer ICL, or what we call the intraocular contact lens. And it allows me to put a microscopic lens in the eye to correct very large amounts of nearsightedness. And we're talking 12, 13, 14 diopters of nearsighted, way up there. And the latest version comes in an astigmatism correcting version. So we can correct the astigmatism, all that nearsightedness, all at the same time, get them out of glasses like this, okay? And this really, for those patients, is life-changing.
Right.
I mean, they couldn't see anything in front of them, and now, good vision again.
So even though LASIK isn't right for some patients, you offer other specialized procedures, like you're talking about the ICL, and Key-Whitman is one of the few places where patients can have access to that full range of options, which is what's so important.
That's exactly right. ICL, LASIK, PRK, and even our lens exchange, where we can give them high-technology lenses.
Okay, so now I'm going to ask about me. I wear these glasses on my head all the time. So let's say that in my early 40s, my vision started to go down, and I started having to wear these to see all the time. I try to make them as stylish as possible, but is LASIK something that I should consider?
Well, that's actually a very different issue, and that is LASIK, generally we're looking at correcting our distance far away vision.
Okay.
Most people have good distance far away vision, but when they get into their 40s and 50s, the lens of the eye hardens, and it makes the eye harder for it to focus up close. It's what we call presbyopia. Completely normal thing. But here's where age takes on an advantage, because as we get older, we become candidates for lens removal, cataract removal, and we then are candidates for things like symphony, multifocal lenses, crystal lenses that can help our vision distance, intermediate, close-up, all distances, and help us decrease our dependence on glasses or contacts.
I knew there was going to be an example where age would be beneficial.
Age really can help.
All right, thank you, Dr. Whitman. You have locations all over the Metroplex. Call 214-220-EYES. That's 214-220-3937 for more information or to schedule your appointment. You can also log on to keywhitman.com to take that LASIK quiz.
Perfect.